All right, here we go. Hello and welcome to Wellness Matters, a speaker series brought to you by Florida Center for Hormones and Wellness. Wellness Matters happens on the third Thursday of every month, and each event features a different speaker covering a different topic, all revolving around health and wellness, as the name would imply. Today's talk is called Hormones, Change Your Balance, Change Your Life. And this evening is going to be a little bit different from our typical Wellness Matters events. That's because tonight we have with us 4 leading experts in the field of bioidentical hormones, and they're here to participate in a roundtable discussion and answer any and all questions that you may have regarding hormones, hormone therapy, and how changing your balance could change your life. With us this evening are 2 of our very own, founder of the Florida Center for Hormones and Wellness, Dr. Joan Carrozzella, as well as our newest addition to the practice, the brilliant nurse practitioner, Joan Keel. In addition, we are joined all the way from Southlake, Texas, by Dr. Terri DeNeui, co-founder of Evexias Medical Group, as well as Dr. Eric Fete, the fitness physician of PrimeX, Cellular Nutrition and Fitness, who is located in Dublin, Ohio. So thank you so much for everyone for coming to us from your respective homes. I also want to thank all of you for joining us because you took some time out of your busy schedule to... Oh, okay, got someone in the chat box. You took your time out of your busy schedule to learn a little bit about something that is a really powerful treatment option, and that's awesome. So before we begin, just want to reiterate, if you are not one of our speakers, if you could please mute your microphone, that'd be really helpful. That way we don't have anybody talking over one another. And feel free to throw any questions you may have into that chat box. I went ahead and got things started by putting an initial message in there, and then you're seeing a couple others pop up. I'm going to go through and I'll field the questions for our speakers. And I've actually got a few questions already, some FAQs, like frequently asked questions that we get here, and then also just a couple questions that I've personally heard patients of ours at the center ask. So that's kind of be the foundation of the conversation and discussion tonight. And that's how we're going to get the ball rolling. I also want to let anybody know that we are recording this talk, and I'll be sending out the recording to everyone who registered, so you can watch this back anytime you'd like. So without further ado, let's get started. I want to start with Dr. Carrozzella. Dr. C, can you get things rolling by telling us just how you got your start in hormones and why it is that you're here?
Sure, Clayton. Excuse me. I actually just got over COVID, and I still got a little bit of cough in my chest. Wasn't really sick, but it was sort of an experience. In any event, I was an orthopedic surgeon for 25 years, and toward the end of my career, as a lot of doctors are these days, got very frustrated with the politics of medicine, taking call, dealing with insurance companies and all kind of political, hospital, and those kind of things. So I was really getting frustrated and kind of burned out. And right around that time, my ex-wife underwent a surgery on her neck at age 49, and literally like a light switch, she went into menopause. And it's not uncommon for a trauma to trigger that sudden hormonal shift. She was right around the age anyway, had that big surgery, and came out on the other side of menopause. And it was dramatic and life-changing. I mean, when it comes to the hot flashes and the night sweats and the irritability and the decline in libido, she had it all, and we're going like, what's up with this? And so we spent the next year running around just like a lot of people do, going, what are we going to do? This can't be the way it is. We're only 49 and we're vital and healthy and active. And we kept getting the same thing that everybody else did. Well, this is the way it is, and get used to it, and put your big girl panties on. This is the way life is, and all that kind of stuff. And well, we didn't accept that, and ultimately came across hormones as a remedy. And one thing led to another, through creams to pills to whatever else, and ultimately ended up on pellets. And it was literally life-changing. And again, it was like just as that light switch was turned off, it got turned back on again. And I had my wife back, and we were connected again, and things were good for that time period. And I said, wow, this is pretty good. And I was looking for a change. And I started talking to the people that were doing her pellets, and they said, oh yeah, well, we need someone to observe and do pellets. And, so I ultimately hired on and started a transition out of orthopedics and started doing pellets at more or less a mill that I recognized at the time, but it gave me my start and actually gave me the impetus to go ahead and say, there's something more to it than just firing pellets in people. And, I took more and more courses. I ultimately became a fellow of the American Academy of Anti-Aging and Aesthetic Medicine, where I learned not only about hormones, but wellness, but physiology, but functional medicine and a lot of things like that. And ultimately went on and got a master's degree and have got multiple certificates in hormones and sexual wellness. And I now mentor with probably one of the greatest hormonal brains in the universe, Dr. Neil Rouzier at World Inc. Medical, and really have been able to bring outstandingly high quality care in the hormone world to the Central Florida area. And it really shows by the excitement and enthusiasm I see in the patients and the almost overwhelming growth that I see in my practice.
Awesome. Yeah, I've heard obviously, because I work for you, I've heard that story multiple times, and it never really stops being an awesome story, does it? It's a cool transition.
It was quite an adventure, and it gives me a lot of understanding and compassion to the people that come in with that story. And I just, you just hear that same thing over and over and over again. And it rather is astounding when you look at the volume of medical literature and the way that traditional medicine just absolutely refuses to see what's out there. I mean, unfortunately, we live in a world today where there are just people who get set in their ways and set in their ideals, and you could hit them over the head with a 2x4 and they still don't want to recognize that there are other opinions and other ways to do things.
Absolutely. All right, I want to pass actually that same question off to Joan. I don't actually know how you got your start in hormones, but I'm very interested to find out.
Brief, but my start in hormones started as soon as I got out of nurse practitioner school. I thought I wanted to do emergency medicine because I had been an ER nurse for several years before I was a drug rep, and then went and got my master's. So that decided I was tired of weird shifts and holidays working. So I hooked up with a physician who had a little clinic doing hormones. And interestingly enough, as much as I knew about hormones, I didn't know all there was to know. So learned from him, and then decided, well, this is kind of a neat foundation, but internal medicine really is my passion. And so I really went on then to pursue more of an internal medicine, psychiatric practice type thing, but with an underlying understanding that hormones played a role in all this. Well, as a nurse practitioner, not having the MD behind my name, I found that I butted heads often with physicians who do not understand hormones, who are never taught hormones, and who refuse to understand that there's more than one way to take care of issues that are occurring in folks that hit about the age of perimenopause forward, and men included, in terms of getting older and losing testosterone. Fast forward to all that, I found Rouzier's course a few years ago, and of course went through all his training and realized that what I knew was good and what he had to teach was even better, and just continue to go and learn. Myself being a person looking in hindsight as somebody who was told my whole life, you're fine, you're fine, you're fine. Yet the more I exercised and the more I ate right, the fatter I got. The fact that I was tired, lethargic, and fatigued at 23, 24, 27, 32, yet told you you're fine, you're fine, you're fine. I was a late bloomer. So by the time I got through nursing school and then through my master's, I realized that I wasn't fine, even though my labs were, quote, within range, so go home. Once I discovered this, and then of course learned hormones out of NP school, and then continued to learn, I just realized that the foundation of good medical health, and this is my approach, is sexual health and wellness is great, but foundationally medical health is based on your metabolic processes. And if we don't address those metabolic processes, guess what happens? Age-related diseases. So I'm very passionate, and the thyroid component of hormones is probably my biggest passion. And I thought I was assertive with thyroid until I met Dr. Carrozzella, who is very assertive with thyroid, and again, continues to instill the confidence to not be afraid to push the envelope, push the numbers. Because ultimately, at the end of the day, what are we treating? Patients or paper? I prefer to treat the patient, as I know Dr. Carrozzella does, as does the folks that are here. So that said, that's my journey as to how I wound up here. I've been doing hormones for about 10 years, underlying with whatever else I was doing, because it's hard to look at somebody and know that you have an answer to their problems and not address it. Psychiatry, especially when I would get a 35 or a 42 or a 45-year-old female or male first-time presentation for depression and anxiety, their primary care slapped them on an antidepressant, sent into psychiatry. I'm like, you're probably not depressed or anxious. You're probably hormonally depleted. Get a full panel, check the thyroid, check the hormones. Guess what? They're hormonally depleted. Adjust that. I don't have a patient psychiatry anymore. They don't need an antidepressant. And interestingly enough, for those folks who are on antidepressants or any other antipsychotics, the data shows by the experts in psychiatry that if you don't have enough estradiol, being male or female, your antidepressants and your antipsychotics don't work nearly as well. It takes 2 and 3 times the actual dose to get you to be effective, to get your depression or your other psychotic issues under control. So why not treat the underlying foundation first, hormones, thyroid, and then work on the insulin component as well, which causes inflammation, which changes cognitive function, not to mention cardiac health and all that stuff. So found Dr. Carrozzella about a year ago, right? Dr. C came down, interviewed, right doctor, right practice, wrong town. I thought, oh, can't do Orlando. I live on Cape Cod because that's where I was at the time. And then I wound up moving back home to Tennessee anyway. And then I thought, well, maybe we could do a little business dating and see if we like each other. Again, right practice, right doc, right staff. And now I'm proud to say I'm here full time. In fact, my house stuff just got delivered today. So I look forward to actually seeing what it looks like because I haven't seen it in a while. So that's how I got here, Clayton.
That was great. Thank you. And I want to say that we're beyond proud to have you join us. So thank you.
I appreciate it. I love being here.
We love having you. All right, Dr. DeNeui, what about you? How did you get started in hormones?
Very similar journey as Joan. It's kind of funny. I was offered a first-class trip to Vegas to a hormone conference, and I was internal medicine, emergency medicine. I worked full-time in the hospital, and I took them up on it because it was a first-class trip to Vegas to, a hormone conference. And so I really wasn't really that committed. But I recall very distinctly sitting there listening to a doctor lecture, and I can't remember her name, but she wrote a book called Awakening Athena. And she started describing the life change in her patients and just patients coming back to life, females she specifically was discussing. And I just kind of had that aha moment that it just felt in my gut that, okay, this is something I need to pay attention to. So I started going to conferences, gobbling up information, and I started my own hormone clinic. I was doing creams and orals and other things. And I was actually losing patients to a local physician who was doing these pellets. And they kept saying, I love you so much, but you got to figure out the pellet thing because it's so much better. And so eventually I connected with a doctor out of Arizona, Dr. Gino Totera, and trained under him with hormone pellets. And, the rest, kind of, as they say, is history. Once I brought that into my practice, what I noticed is after about 4 years, I could no longer, because I had my practice during the week and I still worked in the hospital as a hospitalist on the weekend. And I just had this moral dilemma, that I couldn't see these patients in the hospital and continue to write the scripts that we were writing and not talk to them about what I knew about hormones. So I eventually just left the hospital system, and that was in 2012. And I've been full-time doing hormones in our clinic since 2012. And it's just like Joan and Dr. C, it's evolved. Started working with Dr. Rouzier as well about 5-6 years ago, well, maybe longer, about 7 years ago. Now time flies. And of course I learn something new from him every time we get together. It's always fun. But that's the one thing about this space. And, for those listening, that you're really in a good space with Dr. C and Joan and these practices, because one thing I've learned is I'm never going to know it all. You have to constantly be committed to being a lifelong learner because things change. New patients come up with new things that, my patients teach me more than anything. And so it's constantly evolving, and it's really important to be with a provider that's committed to being open to learning, to growing, and that really understands hormone therapy and hormone optimization. It's not just about, putting pellets under the skin or throwing you on a pill or throwing you on a patch or whatever. You have to really look at the body as a whole, and gut and all kind of thyroid and, everything that, everyone here on this panel is experts at. So it's exciting. I don't know if I was put back in the hospital today, I don't know. I don't think I could do it. So yeah, it's fun.
Awesome. Well, I wrote down that book that you mentioned, Awakening Athena.
Awakening Athena. Yeah.
Interesting. I'm definitely going to pick that up, because just like you, I'm trying as best I can to gobble up as much information as possible.
I was a novice at the time when I read the book, so it's pretty basic. I mean, now everything we know is so much more broad from, that 12-year ago book, but that was definitely the catalyst for my desire to continue to learn more in this space. So
awesome. Great. All right, Dr. Fete, I know that you have a patient in the near future, but do you have a second to kind of get us how you got here?
Yeah, absolutely. Can you hear me okay?
Yep.
Okay. Yeah, so I can appreciate and understand everyone's journey so far. I think we all resonate together on that. So I too was, in my former life, was an ER doctor, and that's kind of how I got started. And, it was great. I loved it. But as I saw so many people that, seeing them at their worst and dying in front of me and trying to save their lives, et cetera. But I'd also see a lot of sad cases that, pretty young people with these, chronic conditions and lists of medications, as long as my forearm, that they really shouldn't have because of a poor lifestyle, poor choices, et cetera. And I thought, man, there's got to be a way to prevent this. So I started looking into preventive healthcare, and I got into hormone optimization originally with the big group called Epigenetics. They've been around for a long time. And then I got involved with WorldLink also, and met Dr. Uzier and his group, been through his course several times. Actually, I just interviewed Neil on my podcast the other day. He's always fun to listen to. He's got a unique manner, let's just say that. So, but learned a ton from him, and I will echo the previous comments about continuous learning. I mean, I'm always, just like everyone here, I'm amazed at how much the more I learn, the more I realize I don't know. I went back and not only have done the hormones, but I've got my certifications in peptide medicine as well, and been learning through that. And now that whole group is kind of splintered off and formed a whole new mastermind group, taking it to the next level. And my thing, Primex Cellular Nutrition and Fitness, is aptly named, and it's perfect timing because that's what we're studying is cellular medicine. It's kind of the combination of precision medicine, integrative and functional, as well as the hormones, breaking it down and treating the body at the cellular level and fixing everything. And man, talk about not knowing stuff. These cellular pathways and biochemistry is stuff. It's bringing back bad memories, but some things that I didn't even know back then. It's phenomenal, and trying to integrate it all together. I'm always, just trying to pick up and learn new things and do better for my patients. And so that's kind of how I got on the preventive wellness side. So obviously I've been dealing, with the hormones and the peptides, the functional medicine. I've been kind of self-educating and learning a lot about the gut, the microbiome, getting into genomics medicine. I've done stem cell PRP treatments for a long time and been integrating that as well, especially with the sexual wellness side. So just trying to tie it all together, and it's challenging, but it's fun, and the patients do well. And, I think I mentioned in the last one, my whole mantra is live to give. I want my patients to feel good in every way so they can pass that good feeling forward to other people and create a chain reaction of feeling good and helping other people, passing it forward. So that's kind of where I'm at. Awesome.
Yeah, I remember with the Meet the Panel that you were part of, when you said live to give, that was really something that impacted me. That's a really awesome mantra to live by.
Thanks.
All right, so with that out of the way, we know why everyone's here, how you got into hormones. Let's go ahead and jump into some of these questions that I've compiled. Whoever wants to grab this one, go for it. But this one I've seen quite often, and I've heard when I've been out in different events discussing hormones. Who should avoid hormone therapy? Like, who is hormone therapy not for?
People that do not want to improve their quality of life and age quickly. Okay. There's not too many people that it's not for. I mean, if someone's very risk averse, or perhaps someone who has an active, cancer or extremely ill, I mean, there's a place for that too. But I think most people that we're all treating are your average person in their 30s, 40s, 50s, 60s and up who just, maybe has some comorbidities and some illness, and they want to get better without taking drugs or surgery. Maybe they will just want to improve the quality of their life, live a little bit, not just longer, but better. So, I mean, outside of those things I mentioned, there's really not much reason not to do it. That's
I'm gonna jump in on that too. I remember, I've done a good bit of business studying. At one point, I had pretty much gotten through an MBA as well. And I'll never forget, in one of the marketing classes that I took, they said, no matter whatever business you're in, you always find your niche, okay? And yet when it comes to hormones, you recognize really quickly that everybody ages, everybody's hormones decline, and therefore, by extension, almost everybody needs hormone balancing at some point in their life if they want to minimize their risk of disease and they want to have a vital aging period, want to live their middle years fully and vibrantly and active. And, we demand more of our bodies and we want to live longer. So anybody that's looking to try to avoid disease, stay vibrant and active, needs to consider hormone therapy to maintain that. Now, the question was, who shouldn't? And it really is hard to find someone that shouldn't. And again, I don't mean to blanket that out there, but I mean, there are instances where hormones help cancer patients. I mean, strangely enough, all we've learned, and many people may have heard, how testosterone fuels the fire of prostate cancer or whatever, and you should never use it. We now know that using testosterone and estradiol in very high doses can actually stop prostate cancer in its tracks. So, when we used to say, no, you can't use hormones with cancer or they cause cancer, the opposite is exactly true. So that whole class of people, which at one point was eliminated from hormone therapy, is now welcomed in. In fact, has an opportunity to live a happier life and a more joyful life. If anybody out there who's ever known anybody that's had prostate cancer with Casodex and Lupron, they'll know exactly what I'm talking about. So it's hard to say everybody needs it, but you know what? Almost everybody needs it.
Well, and I'll add to that, because when you understand that literally head to toe, every single receptor in the human body has receptors for hormones. There's androgen or testosterone receptors on every cell, from eyes to gums to, areas where we wouldn't think of it. So when you understand that a lack of stimulation of those receptors can cause so many just even vague symptoms. I've had patients say, these hormones help with my dry eyes because now I don't have to use my Visine or whatever, my lubricant or whatever. So to Dr. C's and Dr. Fete's point, I can't think of a patient that wouldn't benefit if they are, deplete. I will say that I've had one patient that I can recall in all the thousands of patients that I've treated that I didn't treat with hormones. But he was very symptomatic, and he was an 18-year-old kid who actually had a really great testosterone level. But what he was deficient in was vitamin D and some other, B vitamins and iodine. And there were some other things that we just tweaked with his supplements because, teenagers have a terrible diet typically. And lo and behold, the gas that was in his tank was able to get into the cells, into the engine, if you will, and do the work. So he's the only one I can think of that I didn't actually utilize hormones on, but it was still a hormone conversation, if you will. So.
And if I may add to that point, working psychiatry up on Cape, in fact, I spent a lot of time with a pediatric psychiatrist, and I don't like kids. I don't do kids. I don't have a degree in treating kids for lots of reasons, mostly the math. But that stated, sitting with Dr. Main, who was the psychiatrist up there, he would have these young ladies come in, and they would be there for depression, anxiety, or just not feeling good. And he would say, well, blah, blah, blah. And he'd say to me, what do you think? And I'm like, well, I'm looking at this patient, and she looks like she's PCOS, or she looks like she may be insulin resistant, or it looks like maybe her thyroid isn't working well, or maybe she's bleeding to death every month. She needs some progesterone. And that's the job of the labs to take a look. Something that, again, psychiatry should do, but doesn't do well. He would do it, but sure enough, I would be validated because the labs would come back indicating what you could see by virtue of physical eyeballing and then conversation with the patient. He'd get the young ladies and the young men started on the right medication, be it thyroid or in some cases low dose progesterone for the young girls, get their periods regulated. And guess what? We didn't have a mentally ill kid anymore. Not to say that it's the end all be all cure, but a lot of times people get labeled or diagnosed with a psychiatric disorder that isn't psychiatric at all. It's a physiological issue impacting the psychiatric health and well-being. So we have a few patients in our clinic here. I have several in Chattanooga that are under the age of 18 that are struggling with either PCOS or with insulin resistance or deficient thyroid, and we get them started and get them going. And the quality of life changes significantly when you see a young person who comes to life, if you will, or back to life, and no longer sad and depressed because they feel good. That's just incredibly rewarding. So again, there's not a ton of folks under that age group, but there's still a handful. And being a female of similar age at the time and dealing with issues that I didn't realize I was dealing with, it would have been nice if somebody would have said, hey, I think we got an answer for you. Would have saved a lot of years. So
thank you. All right, so we got a question from one of our attendees, Anne, and she asked, what is the difference between sublingual administration versus the pellets? And she added to that, I've heard that the sublingual formulation can be fine-tuned more so than with pellets.
Well, I'll jump in since everybody else is thinking about it. I kind of disagree with that. I think when you go to a well-trained pellet provider, their experience is going to help get you dosed properly. And what I've actually found is the opposite is true. When I'm dealing with other compounded preparations such as sublingual, oral therapy, or creams, you know, you're ordering a compound, you're rechecking the blood work in 5 or 6 weeks, and then it's out of whack and you're not lined up, and then you've got to throw that away, bring in a new compound. You got to do that for 5 or 6 weeks. You're still not balanced. You got to throw that one away. You bring in a new compound. So it's actually you're bringing it in and you're testing it, and you're bringing it in and you're testing it, and it can take a good 3 to 6 months to get a cream, oral, or sublingual patient balanced. Whereas when you go to a pellet provider that really knows and has seen a number of people, you know by their weight, you know by their hormone levels, you know by their age, you know by their activity levels, and you know they try to come up with these computer algorithms to figure all of that out. But the reality is if you know what you're doing, your brain helps you calculate it. And I mean, not to blow my own horn, but many times we're hitting that first dose pretty close. And if anything, the thing that people worry the most about is, you know, what if you overdose me with a pellet? Am I going to be miserable? What's going to happen? You know, at this point in my career, I don't think I overdosed anybody in the last 2 years. And at worst, it's maybe they come in at 5 weeks saying, oh, I need a little booster. And you just kind of boost them up a little bit and they do fine. And you go from there. And 1 or 2 cycles and you're off to the races for well over 80% of the people. So a very well-practiced pellet provider will get you there faster than these other things. And it makes intuitive sense that, you know, something that you can put it in and out of your mouth or take a pill or not take a pill every other day, it's easier to change and adjust. It really isn't. Now, I'm not saying that there are not definite circumstances when you want to go with a pill or a cream or whatever. There are definitely patients that you're not sure what's going on and you want to have that agility to quickly stop a particular administration and do something else. And so in that case, you know, the pill or the creams or the sublinguals are obviously they're very helpful because you can stop on a dime and go on. But for the overwhelming majority of people, they need their hormones. They're going to be on them for as long as they want to be on them. And getting something that's easy, convenient, and highly compliant, you can't do better than using pellets.
I'll echo John's statement. I think that the key thing there is that I agree with is that it's the art of medicine. I think if you, number one is finding a skilled provider who knows what they're doing. There's a lot of people out there there's a lot of mills and they're kind of these set protocols that don't work. I think I offer, you know, if you know what you're doing, any method of administration is going to be effective with someone who knows what they're doing. That's the bottom line. There are some that maybe an oral is better, for example, estradiol, but again, it can work as a pellet. Just, you know, I offer my patients all three. There's creams, there's injectables, there's pellets. They all work, but sometimes it's more of a lifestyle thing. Maybe someone's they don't like needles. Maybe some people don't like to swallow pills. maybe they're too busy to do a shot every day. It just, I leave it up to the final decision up to them, but I think I offer them all because they all work if you know what you're doing. But that's the key thing, is finding a provider who has some experience and knows what they're doing.
Great. The one thing that you touched on really briefly, which came to mind when I read the question, was that with sublinguals, something I've heard throughout our office that can be an issue is just compliance and making sure that you are regulating your own treatment with that. Because with the pellets, if you get a pellet inserted, it's in there and you don't have to think about it. You don't have to remember to take your hormones. So that might be something to consider.
Sublinguals taste terrible. I mean, you got to stick this nasty thing in your mouth every single day. And after, I mean, even with my supplements on a daily basis that I take, you go after a month or two and you go, I'm just sick of taking these things, and you got to take a few days off. I mean, it's just, I can't even imagine sticking those nasty things under my tongue every
day. And not to, you mentioned a little bit, but just, kind of the roller coaster. That's the other thing, that patients that have gone from daily or even couple of times a week modalities to pellets like better, not only the convenience, but the steady state, because you have to take something every day. You're up, you're down, you're up, you're down. And you don't get that effect with pellets. But there are a few patients that prefer, sublingual for whatever reason. And there's a few patients that I would only do sublingual, for certain reasons, at least to start, like Dr. C said. But otherwise, most people that switch over just feel better because it's just really dialed in, and you have hormone release 24/7. So your body's not metabolizing it and it wears off by 2 o'clock and you got to take another one so you can get through the rest of the day. So it's nice like that.
Great. Yeah. One other thing about, any absorbable method of hormone depends upon absorption across the membrane. And, your skin changes, your gut changes, the mucous membranes in your mouth change. And, I've seen people who have been on, transdermal therapy, and they go along for a year, and then all of a sudden they come in and they go, I feel like garbage again. Is what's going on? I'm putting on more, and it's not working. For whatever reason, their transport mechanisms across the skin shut down. And so it can be very unpredictable. And in some people, some people just cannot absorb across their membranes. So, having that implanted where it's part of your physiology, it can be a big advantage.
Great. All right, we have another question. This one's from Sandra. She said, what relation is there with hormones and epigenetic? It's not a word I've seen before. If anybody else knows it, epigenetic. Whoever wants to weigh in.
I think that's probably a really good question for Dr. Fete, because that's really what
that's what I was thinking. The expert is Dr. Fete is the expert on epigenetics. Epigenetics are the way that your genes respond to environmental influences. Okay, and so if you look at your DNA is all kind of folded up, and as you go through life, it folds and it unfolds. And it just doesn't do that on its own. It does it in response to environmental influences, okay? And, the classic is, well, if you look at any rheumatological disorder, the natural expression of a rheumatological disorder for the most part is about 10%. That means in a pure sterile world, the people with the genetics that say that you're going to be a rheumatoid, they only express themselves purely about 10% of the time. What happens is you go into the world and you've got these toxins and you've got these influences by whatever environmental influence there, and all of a sudden it causes the DNA to unfold a little bit, and it exposes that area where the autoimmune disorder expresses. And so now you've got rheumatoid arthritis because there was what we call in functional medicine an environmental trigger. Okay, so epigenetics is a term very commonly used in functional medicine, and at its core it really says is what is that influence on your genes that's going to cause that gene to be expressed at any particular period of time. Now, as a former orthopedic surgeon, obviously I don't come from the medical background. I know a good bit about epigenetics, but It's in terms of putting it into actual practice. It's new, it's evolving, it's exciting, and it looks like Erica's back. We were just talking about epigenetics, which is kind of your space. And I don't know if you have a comment you want to weigh in a little bit. The question is what is the relationship between hormones and epigenetics?
Huge relationship.
You're on mute, Eric.
There you go. Yeah, that's a great question. Like you said, it's an evolving realm for sure. So, getting into the cellular aspect, epigenetics, it's all the things that influence the expression of our genes, right? Environment, hormones, stressors, toxins, lifestyle, all the above things. So it can play into in a very, very important way. Again, our genes are what they are, but for example, if you get a genomic analysis, you're not married to that diagnosis of something that you see on a gene report, because that can be altered. And hormones is one of the ways that we do that, because it can improve the expression of what comes from those genes, which are the proteins and the enzymes and everything else that our body makes. So they're very highly correlated and can be molded and altered, So for example, say you get a thing saying that you can't metabolize fat, or you're prone to Alzheimer's because of your ApoE4 status. Well, that can be modified with diet, with hormones, with all the other things we're talking about. So it's an evolving field and it's very exciting, but hormones are integral to it for sure.
And also, just correct me if I'm wrong, but some of the recent literature I've looked at is showing that those changes are even happening in utero, depending on what the mother's exposed to, what stressors she's exposed to, environmental, what's her diet, those kinds of things. So we're literally changing DNA, and it's really important for pregnant moms to pay really close attention to not only what they put in their body, but the other psychological stressors, physiologic, all of it. So is that would you concur with that? Those changes happening more in utero? Yeah.
Oh, definitely. Yeah.
Mm-hmm.
They were writing, if you, we were talking about thyroid earlier. There's a old classic book by Dr. Rhoda Barnes that talked about that, and women who were having children, and thyroid disease being passed down from generations depending on their lifestyle and things like that. So it's been around, it's been kind of buried, and like you said, some of the newer studies are shedding more light on it. So yeah, it's something that starts from day zero all the way up.
Day zero. Yeah.
Wow. Well, I'm glad. It looked like you stepped away for a second there, Dr. Fete, but I'm glad that you got to come back, because as soon as that question got brought up, Joan and Dr. Steve were both like, that.
Where's Dr. Fete?
I'll be in and out.
All right, we have another question in here. This one's also from Anne, and she's asking, as a long-term endometriosis sufferer, I hope I'm saying that correctly, is hormone replacement therapy safe? Do you adjust the formulation for people like me, and if so, how?
I say yes.
Jump in on that one, or Joan.
Yeah.
Do what?
Oh, well, he was just saying one of us jump in on that. Endometriosis patients, sometimes you have to, depends on where your endometriosis was, I'm assuming uterine. Yes, there can be some adjustments, but what I found is patients that have a history of endometriosis and go through hormone changes actually do much better on hormones. It doesn't exacerbate or worsen. In fact, I have, interestingly, I had a patient that had these spontaneous pneumothorax, meaning, her lung would collapse. And what they finally figured out was she had endometriosis in her lungs. And she got on hormone pellet therapy, and that was for the first time in over a decade. She didn't have those anymore, and she was only on testosterone at the time. So that's one of the ways she knew her levels were coming down. And it was kind of accidental. They put two and two together because she came in for hormones for another reason. And then she noticed she wasn't having these spontaneous pneumothorax every month with her menstrual cycle. And they finally diagnosed her with endometriosis in the lungs, which is very rare. But my point is, for her, it was life-saving because she wasn't having these issues with her lungs when she got on the hormones. So it's been, in my experience, especially with testosterone, I've seen improvements. And you guys will have to just add to that, but I haven't seen it being a contraindication or an issue.
Okay.
I have not either. I will tell you, it's been beneficial, and women feel better. For whatever reason, it just tends to put a lot of the issues that they experience at bay, and they actually get their life back, for lack of sounding cheesy, or for sounding cheesy, I should say. Makes a big difference.
So she had kind of a two-part question there, and I'm not sure that we touched on this one, but do you adjust the formulation for people dealing with endometriosis at all? Is there some kind of...
Yeah, so Clayton, you know, obviously, when you're balancing hormones in most people, you're going to be looking at, you know, particularly the progesterone, testosterone, and estradiol for women, and thyroid. I'm going to put that one off to the side for a minute because we're talking more pelvic orientation here with endometriosis. But, you know, to some degree, that endometriosis tends to be worse in younger women during the high points of their menstrual cycle when their estradiol levels are very high. And so there is likely going to be some correlation between balancing their hormones and taking advantage of the endometrial suppression properties of progesterone. So when you are dealing with women that have had rough courses with endometriosis, you're going to probably be a little bit more cautious on the estradiol side and probably a little bit more aggressive on the progesterone side, trying to find that perfect match. Again, and I was listening to a podcast yesterday, funny enough, with another Rousier practitioner. It's funny, you listen to these guys and within 5 minutes,
you know who they trained with.
Minutes, you know where they got their training.
Yeah.
And then the guy said, well, you know, one of the things that we're taught is that every hormone patient is like a snowflake. And, you know, of course, in common parlance, I don't like that application of that word, but in this instance, it's perfect because everybody is so different that you just have to find that combination that works for each and every person. And that's, you know, that's where experience comes into play. Seeing a lot of people comes into play because you learn all these little tricks and ins and out and little ways to make adjustments that are going to help a greater variety of people become comfortable. And it goes right to the heart of this issue about finding that perfect subtle balance between estradiol and progesterone to deal with that endometriosis patient. And I'll tell them up front, you know, it's going to be a little bit harder with you because we've got a delicate pathology that can be very upsetting to your body. And so you got to be understanding that I got to find out how your body responds when I do these things. And the only way I can do that is to get feedback and then adjust on the basis of the feedback. You know, that's frustrating sometimes when people want that pill and they want to be better. And you do one thing and they say, this doesn't work for me. And then they leave. And particularly in these complex issues like endometriosis that do take a little bit of time and understanding in seeing how things unfold as you work with these people. It is dealing with it, each and every one of them as a snowflake.
Yep. And I would say historically, the patients that have a history of endometriosis that I've treated that have been a little more challenging have been premenopausal women. The postmenopausal women with a history, I don't really have a lot of issue with because they're not having these big fluctuations in the estradiol. They're pretty steady. So that's where it's a little more challenging.
100% agree with that.
So what I'm taking away is that wellness in general is not an art form of instant gratification.
Well, it can be. I mean, I'd say well over 80% of the time you make dramatic impacts on people in 2 to 3 weeks. But like with anything, I mean, people are people, and if they've got complex stories or complex physiology, it's just going to take a little bit longer. I mean, it really is kind of sad that we're into this, take this pill and you're better tomorrow world, because people just aren't like that. I was talking about that today. I mean, you know, back in the early days with Premarin and Provera, that was the goal. Here, you got menopause, there's 3 formulations of Prempro, and this one works, and that one works. Well, it's not working for me. Well, then too bad. What do you do now? I mean, that's the beauty of going to doctors who actually think and try to understand and work. And it gets so darn frustrating because, you know, the people in this group are big thinkers and the physiology experts and know this stuff inside and out and are able to make these fine adjustments. And yet we're called, you know, really bad things. And yet I think some of these people are in the hormone world are the smartest doctors I've ever come across.
Mm-hmm. Yeah, I agree. Yeah.
All right, we got another question in from Dan, and Dan is asking, are there any peptides that give the same benefit as growth hormone in terms of anti-aging, body composition improvements, etc.? And he's specifically curious as growth hormone is very expensive and he's looking for lower cost options.
Yeah, I can feel that one if it's if everybody's okay. Yeah, definitely. The short answer is yes. A lot of the peptides are actually superior to the growth hormone in many ways. Mainly, yes, cost. They're definitely less expensive, but they're also safer. Growth hormone is an exogenous hormone. Unfortunately, it creates more of a synthetic burst of growth hormone, which is not timed to the normal circadian rhythms. Whereas the peptides actually induce your body to make growth hormone on its own circadian rhythm, which is more natural. And it's a little bit more safer in terms of how it does that. In addition to that, they have pleiotropic effects that growth hormone doesn't have. What I mean by that is that it has its own effects on the body that out above and beyond growth hormone itself. So these peptides, these receptors for these specific peptides are all throughout the body, and they have their own beneficial effects on the body that just you don't get with just growth hormone. So they're very intimately involved with what we call cytoprotection. In other words, protecting the cell to heal, and inside the cell for the mitochondria, which are the energy generators of our cells, little powerhouses as they're called, to function properly, to burn fuel efficiently, to stay healthy, to prevent excessive free radical production, which is aging our body, and many other things. So the bottom line is, yeah, some of these what they're called secretagogues or growth hormone receptor releasing hormones or releasing peptides, definitely a little safer, more natural than pure growth hormone, and they're definitely less expensive.
Awesome. So Dr. DeNeui just let me know that it was her time. She had to head out. So farewell, Dr. DeNeui. She's not here to hear this, but thank you so much for joining us. Maybe she'll listen back to the recording to hear what she missed. All right, I have another question for you guys. Anyone can field this one. What can you do if you, for whatever reason, are not finding success with hormone therapy?
Well, as with anything, there are people that have trouble receiving the treatments that we give. And, it comes up. Overwhelmingly, hormones are successful, but when you find someone who's not responding, there's likely another explanation. And it gets down into the biochemical and, physiological world where you start talking about receptor sensitivity and, DNA and RNA and transcription and all of these kind of things, because you can give the hormone, but it's got to attach to the cell, and then it has to signal into the cell. That has to have signaling molecules into the cell that go into the DNA that then produce the responses that you want. And anywhere along that line, if that process is disrupted, you can use a hormone and you can not get the result that you want. So you end up looking for more esoteric things. Are they toxic? Do they have heavy metal poisoning? Are they chronically inflamed? Do they have a food sensitivity that's setting off a problem? Do they have autoimmune disorders? So it gets to be very, very challenging and very difficult when you take someone that does not seem to be responding. I was just dealing with another patient just in the last week that no matter what dose you're giving them, they're not responding to testosterone and not responding to testosterone. And I was getting a little bit frustrated about it, so I got into their history a little bit more, and I found out that at one point they were doing body training and taking synthetic steroids, and synthetic steroids will get in and they'll absolutely poison your body's receptors, and they will poison the areas of the DNA and the RNA that are responsible for replacing those receptors as we go through the normal evolution, to the point where these people become extremely resistant to testosterone and require very high levels of testosterone in order to get by. So, there's a case of, taking a synthetic hormone that's extremely toxic to the body and causing an adverse reaction that then becomes difficult to overcome when they start to undergo the aging process and you're trying to get back in some of the normal hormones. So yeah, I mean, there are things to do. They present challenging problems. Those are the ones that, end up in the more advanced hormone doctor offices because, everybody else has not a clue what to do, and everybody just gets frustrated, and they go from one doc to the next, to the next, to the next, until I find out somebody that's the expert, and you fix one of them, and all of a sudden you got a whole office full of them.
Joan, do you want to add on to that at all?
Sometimes it's a matter of finding, you need more than one therapy approach. I'm not adverse to and kind of actually appreciate a dual therapy. Sometimes a cream with pellets is a nice option. Sometimes a pellet with oral is an option. A lot of it's relative to, sometimes you just push it in one direction only. The body can only absorb and do so much, but if you add a different modality of absorption, be it sublingual, be it a cream, be it injection, then for whatever reason it turns on those receptor sites or pathways and people start to get good response. My personal experience has been that it's best to set the expectation with folks from the beginning. Yes, you can get some instant gratification. You can get people feeling better relatively quickly, but I like to under promise and over deliver. I am more of a, it's going to take a couple of rounds. It's going to take anywhere from 3 to 6 months, especially for women. Men get there a little quicker. They're less complicated biology. That stated, sometimes just hitting 2 different therapies will get people where they need to be. Had a patient in that's been doing hormones for 2 years, in fact, here, and she's just not feeling what she thinks she needs to feel. And her labs are decent, but they don't really reflect a great uptake. So we step back and we're punting. We're changing things up completely. And we're going to give this a trial, and I'll report back in 5 or 6 weeks and see how things are going. I did hear from her last night, which is a couple days after I saw her, and she stated that she feels like this may work. And again, did she get instant coverage in 2 days of doing a different modality? Probably not. But most importantly, she's receptive to receiving hormones in a different manner. And that can go a very long way to seeing if we can't get her feeling her optimal best, which is ultimately the goal.
Great. Thank you.
Mm-hmm.
All right. Here's one that I just hear in the office often enough that I felt like we should maybe cover it. What is a compounding pharmacy?
Well, a compounding pharmacy, there's, I'll start by saying that there's so much misinformation out there about compounding pharmacies, yet they do such a wonderful job. A compounding pharmacy is an institution, is a pharmacy that takes FDA-approved products. And I want to be absolutely 100% clear, because the first bit of misinformation is that things that come out of the compounding pharmacy are not FDA approved. Everything that goes into a product coming out of a compounding pharmacy is FDA approved. In fact, for the most part, and we try to stick to this in this office, it's hard to all the time because we get some special requests. For the most part, the compounding pharmacies that we use are what are called 503B pharmacies. That means they are under the same FDA supervision as a pharmaceutical manufacturing facility. They'll adhere to the same standards of quality and purity, okay? Now, what makes a compounding pharmacy unique? That is, we can take the FDA-approved products and we can deliver them to people in different modalities. Cream, we can take what used to be a pill and turn it into a liquid. We can make it into a cream. We can turn it into an injection. We can make it into a pellet. We can put it into different form, and we can put it into a different dose. And it allows a very well-trained physician to use his intelligence to come up with a combination of a known medicine and use it in a way that'll get the best benefit to the patient. Some people absorb better across the skin. Some people do better across the gut. Some people need to have it injected. And that's the beautiful thing about the art of medicine, is when you can take an intelligent person who knows how to practice medicine and knows the pluses and the minuses of these different delivery methods, and knows that, well, that 50 milligram pill that's made by the drug company is a little bit too weak, yet the 100 milligrams is too strong. I want something in the middle. Well, you can go to a compounding pharmacy and they can take the raw ingredients that go into the 50 and turn it into a 75, and you get the same thing, except it's just in a different dose or in a different form. So compounding pharmacies are wonderful, wonderful facilities. They're under vicious attack right now by the FDA. You know, and I tell people, I said the reason is between compounding pharmacies and doctors who know how to apply alternative principles in medicine that are well-founded in the medical literature are making people healthy. And by making people healthy, they're less reliant upon big pharma. And therefore, when big pharma doesn't make money, the FDA is not happy. And sad to say, I think that has a lot to do with what's going on right now. I mean, why would it be that the FDA is looking to ban hormones, which make people healthy, yet cigarettes haven't been banned? The bottom line on both of those is by allowing cigarettes to exist and by trying to take away hormones, you create more sickness, thereby more profit to big pharma. That's the only thing that binds those two decisions together.
I agree.
Such an interesting topic.
Oh, it's political.
Yep.
Oh, yeah.
It's all about the dollars and who's getting them.
Okay, I have one. I found this one actually when I was doing a little bit of research a couple of weeks ago, and I thought this would be a good time to ask this. This person asked on another practice out of state's website, but they asked, I've used alcohol to excess or drugs like marijuana in the past. Will I get the same effects as other patients?
So to the answer to that is relative to how long has it been since we've used or used in excess alcohol, marijuana, or other drugs. A lot of it comes down to how much damage has been done at the cellular level. There is some regeneration that occurs when one stops smoking tobacco, for example. It takes about 7 years to regenerate the lung tissue to be basically, quote, brand new. It's relative. It's relative to what damage has been done, how long it's been since they've been on substance, how much did they use the substance. There's multiple variants in that answer. But will they benefit from hormone replacement therapy? Yes. It's just a matter of, again, tweaking the dose, finding what works, the modality that's most appropriate given what is functional. But yes, absolutely.
You know, and one of the things is these people in their liver ramp up their detoxification pathways. And so what will happen is they may burn through their hormones a little bit faster. So you just, you know, that is an issue we deal with all the time because people have variable metabolisms. So it's something that we just notice in the course of normal management. But yeah, if you're particularly an alcohol abuser, you tend to metabolize a lot more things, a lot more drugs, a lot more substances faster.
Interesting. Yeah, I've been wanting to ask that question to you too, but I just had to save it for this one because I came across it. It really piqued my interest because I'm sure that there are people wondering that, but they just, you know, maybe they're not going to bring it up. All right, so I think it's about time to wrap this up. Unfortunately, Dr. Fete had to leave as well. So with just the three of us here, I would like to thank you guys for taking the time to do this and being a part of the Wellness Matters series. Thank you to all of our attendees, everyone that registered. And if you're watching this and you are one of our registrants, but you weren't able to make it, thank you for watching the recording. Glad that we could provide such an informative session for you guys. So I want to let you know before we leave that on Thursday, January 21st, we'll be having our next Wellness Matters event. And that one is called Superfoody Home Cooking. It's going to be hosted by a wonderful gentleman by the name of John Barr. And it's going to be about introducing some new diets, some new ways of keeping your fresh so that you can eat healthy at home and keep things fun and interesting so you're not just going down some rabbit hole that might not be sustainable for you. It's going to be kind of like cooking show style. It'll be really interesting, and I'll make sure to include the link to register to that in the email that we'll send out with this recording. So it'll be really easy for you to sign up, and we hope to see you there. Thank you again so much for joining us for Wellness Matters. For any information regarding bioidentical hormone optimization therapy, please go to our website, hormonesandwellness.com, or give us a call at 407-507-3837, and anyone at our office would be more than happy to help you. So thank you so much for joining us, and everyone have a great evening.
Thank y'all.
Take care now. Thanks, Clayton.
Mm-hmm.